Today I'm so excited to be here. Woke up this morning just very eager to get this going. I've been wanting to do this for well over 10 years and just very happy to have finally made it into Dr. Maercks' good hands. I feel like I'm in really good care, probably the best care I can be in. So today I'm getting stuff done on my chin, and I'm getting this done here to here, except for my nose. So I'm getting my under eyes done, my over eyes done, eyebrow lift, facial lift here, and chin lift. And when I first started talking with Dr. Maercks, I really wasn't sure what I was gonna do. I knew I wanted something done here, and then we just went over all the different options and possibilities, and just felt really confident about all the procedures that we went over together.
She wants really a deluxe kind of facelift. She wants all of these drooping and aging changes addressed in a very natural way, and she doesn't want to go to sleep, so she doesn't want general anesthesia. We offer here at the Maercks Institute, where we do just about everything on the face with the exception of some extreme rhinoplasties and genoplasty where we want to protect the airway, but facial aesthetic rejuvenation, facelift, and everything in that spectrum is available anywhere from wide awake to general anesthesia. And the funny thing is, I don't do much different. So even when I do general anesthesia, I use this stuff called Exparel that numbs the face for 3 days. So even when patients are asleep, we block the pain receptors. So it's really no problem, and doesn't really take much of a modification in technique to do it awake. It just takes the right kind of person that wants that and is cool with doing it. So as you'll see, and our patient is gracious enough to share her experience, so we'll take you through it. You'll see we're gonna go to the OR, we're gonna listen to music, we're gonna hang out, it's gonna be a vibe, and I would bet at some point you'll fall asleep a little bit.
From the first phone call to the pre-op yesterday, I just had so much fun with everybody. Everybody's so kind and stellar personnel here, couldn't be better. Very welcoming, very warm, very relaxing, putting me at ease. I couldn't feel more confident than I feel right now. Had consultations with several different doctors, and a couple of them out of the country even, and had decided on one in particular that I was really happy with. Their facility looked amazing. And then Dr. Maercks showed up on my social media. And as soon as I saw Dr. Maercks and saw the difference between his work and everybody else's work, I just abandoned all of my other plans and went with Dr. Maercks without hesitation or just no reconsideration of it, just straightforward. Every single Instagram client that I looked at of yours, the results are phenomenal.
I love it.
Yeah.
I love it. And actually, the funny thing is, it's a little bit more fun for me to do it under local, because under general it's easier because the patient's out of it, but like you're like not really with the patient, and it's kind of cool to be with the patient through the experience. And I think you guys will enjoy watching this. So we'll be off to the races in a few minutes.
Okay.
All right.
Awesome.
Let's go.
Thank you.
So we're about to go back on a very special day and a very special patient. You met her earlier. We're about to get started on a full, deep plane composite facelift with a monoblock lift technique with a submental lift, removing the fat, tighten those muscles, lateral browpexy, and tweaking the eyes. She's wide awake, will be talking to us, we'll take you through it. Including if the lights are bugging, you tell us. There's stuff we can do about that. There's stuff we can do about everything. And so yeah, we are here ready to get started. Wide awake patient. Say hi. So she's wide awake, and we're just gonna go ahead and start the facelift procedure. And should be absolutely zero pain. Yeah? Yes?
No pain.
No pain, that's what I'm talking about. we did a deep plane composite, the monoblock lift, lifting all the face and neck up with a lateral Browpexy, or we call them micro lift technique, and a deep submental lift, which means we took out that blanket of fat under the skin, what we call a nugget of fat under the muscle, and really tightened up all those muscles that way, and lifted that face way up. Really impressive result from a really hangy neck to a really tight, refined neck. So yeah, so we're just gonna make this incision that sits right in that crease everyone has underneath their chin. And what we're gonna do is we're gonna meticulously, and without seeing any red stuff, we're gonna take out all that fat there that's causing the problem, which will give us the opportunity to do some magical muscle tightening, right? Right, there's a smile. So I want to be cognizant of this. I do kind of like a micro technique, minimal dissection, suspension, but also with a canthopexy, which means we take the corner of the eye and kind of cat-eye it up, holding the muscle, the structure, the cartilage of the lid to the bone. So really natural looking support the way it is originally, with a little bit of lateral canthal elevation. That means this side of the eye a little higher than that side of the eye, very feminine, and straightening up the lower lid, cleaning up the excess skin and the excess fat, and then going here in a sneaky, minimally invasive manner to lift the brow up that way through the upper eyelid incision to minimize other incisions, no hairline incision, anything like that. Patient's doing well. We just wrapped her up like a mummy, and we can go take a look at her if you want. We're gonna walk sister in to see her sister unwrapped.
Wow, it looks really good.
Can you see yourself in the mirror? No? Okay, a little blurry.
Yeah, I don't have my contacts in.
All right. So we, in addition to the deep plane facelift, we of course did the periorbita. We took care of her eyes. Beautiful, but square face, kind of like with all this rendezvous and stuff.
Yes.
And her face looked like long and square. Now it's like smaller and heart-shaped.
Yes, yeah, and even this is all gone.
We can see that it's really a night and day kind of difference from the excess skin on the neck, all smoothed up, this very square rectangular shaped face, this more, as you say, heart shaped. This weird swelling is fine, it's gonna go away. The corner of the mouth is heavy because of the swelling, but that's gonna come all up. I'm trying to get the pen to work, but it's not. If you transpose that shape is really like, you wouldn't believe it. It like goes up and over and back down here. So huge change. Yeah. The submental lift really got that to push way up. Even with the swelling, we can really see the angle of your jawline. And the swelling goes down, the kind of relative hollow here will continue to come up, the cheek elevation, and then matching it with, oh, that's pretty cool. You can see how the tail of the brow is like falling into almost your eyelid.
Oh yeah.
And then with support, it's like way up here.
I think it's really a combination of things, but I did not know my jaw would be able to look like that. That I'm so happy with. Like, I almost makes me want to cry because I have hated my jawline. And then the way it balanced my nose out, I don't look like my grandpa anymore.
You never look like your grandpa.
I told my sister, I got grandpa's nose. Well, now I feel like my face matches my soul.
Oh, I love that. I love that. Your face matches your soul. That's what we're going for.